I often hear patients tell me that they went to the emergency department with chest pain and were worried it was a heart attack. But when I hear them describe the pain as sharp, worse on breathing in, better leaning forward, I often think of a very different diagnosis. Today, I want to explain pericarditis, myocarditis, and myopericarditis, three conditions that are sometimes mistaken for a heart attack. If it's your first time here on my channel, welcome. My name is Hafiz and I'm a cardiologist based in London. I create videos to help you to keep your heart healthy and explain heart conditions in a way that I hope is easy to understand. If that interests you, then click on the subscribe button and bell icon so you get notified every time I release a video. To understand these three conditions, we need to start with a bit of anatomy. Your heart has two key structures that I want you to think about. The first is the myocardium, what we call the heart muscle. This is the muscular wall of your heart, and it's what pumps blood around your body with every single beat. The second is the pericardium, what we call the pericardial sac. This is a thin, fibrous protective bag that surrounds your heart. Think of it like the casing that your heart sits in. It helps protect your heart, reduces friction as it beats, and keeps it in position within your chest. Now, when we talk about inflammation of these structures, we get three conditions. Pericarditis, which is inflammation of the pericardial sac, myocarditis, inflammation of the heart muscle, and myopericarditis, when both are inflamed at the same time. Let me go through each one. Pericarditis is the most common of the three. When the pericardial sac becomes inflamed, it causes a very characteristic chest pain. And what I always ask my patients about is how that pain behaves. It tends to be sharp and stabbing, often in the center of the chest, and it gets worse when you breathe in deeply, when you cough, or when you lie flat on your back. It also often improves when you sit up and lean forward. That posture takes some of the pressure off the inflamed sac. It's a classic sign. Now, myocarditis is different. Because this is inflammation of the heart muscle, it can affect how well the heart pumps. In mild cases, patients may just feel unusually tired or a little short of breath, but in more severe cases, the heart's pumping function can become impaired, which is more serious. Patients may also experience palpitations, what we sometimes call an irregular or racing heartbeat, and sometimes chest pain, although this tends to be less sharp than pericarditis and more of a pressure or heaviness. And then there is myopericarditis. This is where a patient has features of both conditions, but the pericarditis is the more prominent element. Now, they may have that classic pericarditis type chest pain, but blood tests also show elevated cardiac biomarkers, what we call troponin, which tells us the heart muscle has been involved too. I've done a separate video on the troponin blood test, so check it out later. There is also a closely related condition called perimyocarditis, where it's the other way around. The myocarditis is more dominant, with some pericardial involvement. In practice, the distinction matters because it guides how closely we monitor the heart's function. So what actually causes these conditions? The most common cause across all three is a viral infection. In fact, in the majority of cases, we can't always identify the specific virus responsible. Common culprits include the Coxsackie virus, the influenza virus, and more recently, COVID-19. Other causes include bacterial infections such as tuberculosis, autoimmune conditions like lupus or rheumatoid arthritis, and in some cases, certain medications. You may also have heard about myocarditis or pericarditis following COVID-19 vaccination. This is a recognized phenomenon, but it's important to put it in context. It is relatively uncommon. It predominantly affects younger males. The cases are typically mild and self-limiting, and the risks of developing myocarditis from a COVID-19 infection itself is significantly higher than from the vaccine. If a patient comes to me with symptoms that might suggest one of these conditions, there are several investigations I want to do. I'll start with an ECG. In pericarditis, there are often characteristic changes, what we call saddle-shaped ST elevation, that are quite recognizable. Myocarditis can also cause ECG changes, particularly arrhythmias. We'll check blood tests, specifically markers like CRP, which is a general marker of inflammation, and crucially troponin, which tells us if the heart muscle has been damaged. We'll do an echocardiogram, an ultrasound of the heart to assess how well the heart is pumping, and to look for a pericardial effusion, which is a buildup of fluid inside the pericardial sac that can sometimes develop in pericarditis. And in cases when we're concerned about myocarditis or myopericarditis, we'll often arrange a cardiac MRI. This is currently one of the best tools we have for detecting and characterizing inflammation within the heart muscle itself. I've done a separate video explaining the cardiac MRI scan, so you can watch it after this video. So how do we treat these conditions? For pericarditis, the main treatment involves two medications used together: anti-inflammatory tablets, usually ibuprofen or aspirin, and a drug called colchicine. Colchicine has been shown to significantly reduce the risk of pericarditis coming back, which is important because recurrence is one of the main complications we try to prevent. For myocarditis, the cornerstone of management is rest, and importantly, avoiding strenuous exercise until the inflammation has completely resolved. This is something I feel strongly about. Vigorous exercise during active myocarditis can be dangerous and can cause potentially life-threatening arrhythmias. In more severe cases where the heart's function is affected, patients may need medications to support the heart and sometimes hospital admission. For myopericarditis, we follow a similar approach: anti-inflammatories and colchicine, but with closer monitoring of the heart function given the muscle involvement. Activity restriction is again very important. In some specific situations, for example where there's an underlying autoimmune cause, steroids or other immunosuppressive medications may be used. But this is decided on a case-by-case basis. Now, when should you seek help? If you develop a new sharp chest pain, especially one that worsens on breathing in or lying flat, please do get it checked. Don't dismiss it as muscular pain. Pericarditis can sometimes mimic other causes of chest pain, including a heart attack. If you've had a recent viral illness and now have chest pain, breathlessness, or palpitations, that combination should always be taken seriously. The good news is that for the vast majority of people, particularly those with viral pericarditis or mild myocarditis, the outlook is very good. Most people make a full recovery with the right treatment and rest. So just to recap, pericarditis is inflammation of the sac around your heart. It is characterized by sharp chest pain, worse when breathing in, and often better when leaning forward. Myocarditis is inflammation of the heart muscle. It can cause breathlessness, fatigue, and palpitations. Myocarditis is both happening together, with the pericarditis dominant. Viral infection are the most common cause across all three. We diagnose with an ECG, blood tests, echocardiogram, and often a cardiac MRI. Treatment is anti-inflammatories, colchicine, and critically, rest. I hope that was helpful, and thanks so much for watching. If you've been diagnosed with pericarditis or myocarditis, I'd love to hear your experience. Let me know in the comments below. And share this video with someone you think will benefit from the information.